They're sending semaglutide acetate, semaglutide sodium, semaglutide attached to something. Where did they source their semaglutide from? They're not allowed to do this legally. So what country in this planet are they getting it from? What is it actually? No high-pressure liquid chromatography has been done on it. We don't know what it is. It could be anything. Is it sterile?
This is Medspa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate Dee. Together, we explore the wild west of medicine that is the aesthetics industry. Welcome back to Season 2 of Medspa Mayhem. Today, Judy Rubin is back, and we're talking all about Ozempic and Semaglutide and the latest in medical weight loss. This is truly the first drug that's captured my interest as something that might actually be worth it for many people. Right now, there are a lot of people already on it and losing a ton of weight, and many places offering the drug illegally to cash in on the trend. As always, if you have questions or a story you'd like to share, or if you'd like to hear more about a topic on the podcast, please reach out. The contact form at medspammayhem.com, which is the same as drkated.com. Goes straight to my inbox, and you can plug in Medspa Mayhem or Dr. Kate D into your browser, and you'll find me. So I hope you enjoy this discussion. Hi, this is Dr. Kate D, and I'm back today with Dr. Judy Rubin to talk about Ozempic and the whole weight loss trend in this country. So Judy's been on the podcast before, but by way of introduction, she is a physician, originally from New York, went to SUNY Downstate for medical school, and did her residency training both at the first year at Stony Brook in New York and then at UC Davis in California. And she has been in practice for 20 some odd years. She can correct me on that. And she's been doing aesthetics for well over 20 years. So Judy, thanks so much for being back on the podcast.
Thank you so much for having me. I always enjoy doing these.
Yeah, it's been really fun. We've talked about Botox and IV bars. You're on the very first program. And then we did a really great episode on vaginal rejuvenation, which was super interesting. I got a lot of phone calls and interest after we talked about that. But today I was really hoping to talk to you about Ozempic because basically everybody and their dog is really either doing it already or interested in doing it. And I know there are some really great pluses and some also big minuses about it. And so I was hoping to ask you about your practice and how you do it and the way it needs to be done to make sure that people are taken care of. And then all the kind of crazy things that are going on because a lot of this is very fringy and off the grid.
Yeah, absolutely. So we are a physician's office and we have somewhere between 160 to 200 patients who are on either Ozempic or Mounjaro. I do a history and physical on every single patient. I make sure that they don't have any thyroid nodules, that they don't have lung disease or heart disease, that they don't have cholecystitis, which is an infection of the gallbladder, that they don't have pancreatitis, and there's no contraindications. They're not on other diabetes medications that would cause a low blood sugar.
So before you go on, so can you explain just a little bit about why you have to do a medical examination before people go on these weight loss drugs?
Sure. There are contraindications to taking these medications. Patients might not know by history that they have these contraindications. One of the contraindications is anyone who has a thyroid nodule who might have multiple endocrine neoplasia. You have to feel the which is a horrible cancer that starts in the GI tract and then it metastasizes to either the thyroid or to the parathyroid glands in the neck. So important to do a physical examination to exclude those patients who might have that very rare multiple endocrine neoplasia. Also important to make sure that the patient doesn't have a tender gallbladder or a tender pancreas.
Because those things can be involved if you go on Ozempic or Mounjaro or the generic versions of this.
Yes, so they are known to cause pancreatitis, but they're also known to decrease the incidence of pancreatitis in people with chronic pancreatitis, which is very
Well,
interesting.
that's interesting. So,
Yeah.
can we back up here for just a second and just talk about what the drugs are that are available currently that you use in your practice?
So we use semaglutide, which is also known as Ozempic, and tirzepatide, which is also known as Mounjaro. Their mechanism of action is extremely close. So both of them decreases the amount of sugar that's being produced by your muscles and by your liver, and it increases the amount of insulin that you produce, but does not cause low blood sugar, also known as hypoglycemia. It also fills the GLP-1 receptors rather inside of your brain, which causes satiety. And it fills the GLP-1 receptors inside of your gut, which causes the movement in your gut to be slowed down. Yeah.
So, as a result of taking these drugs, you're less hungry, right? You feel sated more easily. You
Yes.
don't really want to eat as much. I'm told, I've not tried these drugs at all, but I'm told that it also decreases your desire for alcohol. Have you seen that as well?
I, I actually have patients that I treat not for weight loss or diabetes, but for substance abuse.
Oh,
Um,
interesting.
I
Okay.
have one patient who is a cigarette smoker who has tried all of the medications for quitting smoking and also Nicorette gum and patches, and she has been unsuccessful. And I've had her on an extremely low dose of Ozempic for the last 4 to 5 months, and she has not smoked any cigarettes. She has no
Amazing.
desire.
On a really low dose, too.
Yes. I have
Yeah.
another patient who's an alcoholic who used to drink 10 shots of tequila a day. That's an enormous amount of alcohol. And she didn't tell me that she drank when I did her initial exam. And over a period of a month, she stopped drinking alcohol completely, and she's now clean and sober.
Wow.
Yeah.
Okay. Wow.
I have many patients who tell me they come home from work and drink 2 glasses of wine, which is 2 big glasses of wine, and now they've lost their taste for alcohol.
Wow. So that's really interesting. So that makes it even more like tempting to try it myself.
A lot of uses. It increases dopamine in the brain as well. So
Uh
by
huh.
increasing dopamine, you're not wandering around looking for something that is going to increase your dopamine, like chocolate
Right.
after dinner when you're not really hungry.
Right.
And
Right.
it just turns off the food noise. And I think it does that in a combination from being an agonist of the GLP-1 receptors and also increasing dopamine.
I think that's a really great way of talking about it. So it turns off the food noise, which is really interesting because I've talked to a number of friends really, and it doesn't matter whether they're big or small. A lot of people have a lot of food noise, like they think about food all the time. And so this basically just turns that off.
Yeah, completely.
That's amazing. Okay.
So you can have a food aversion. For instance, last night, because I am taking this medication and I've lost 23 pounds. Last night we decided to have a barbecue and I made 2 burgers and I ate half a burger and that was all I wanted to eat and I pushed
Hmm.
it away. You just are have early satiety, just not
Okay, cool.
interested in food. You don't think about food.
So let me ask you about the practical part of this. So you do an initial intake, you get someone's history, do a whole physical exam, make sure they're a good candidate for it.
Yep.
Then what happens next? Like, how do you? It's an injectable, right? So how do you provide it? Do you inject it yourself? Do patients inject themselves? What's your
Yeah.
program like?
All good questions. First, I give them informed consent, tell them how the medication works, tell them the side effects that they may have and how we can deal with those side effects. And I answer their questions. And I say a very common question is, what do I do when I reach my goal? How do I not regain the weight that I've lost? So answer all of their questions, and then I inject them with their first dosage, which is as the FDA has guided us to do, which is a 0.25 milligram dosage. And we keep the patients on that dosage as long as we possibly can. And we keep them at that dosage because you get used to it and it really minimizes side effects. You get into trouble with semaglutide if you increase the dosage too quickly. So we medically monitor every patient every week. And we buy our medication from a 503B compounding pharmacy, which is for office use only. The FDA has said to those 503B compounding pharmacies, we want you to make this medication because we are short. We need more of this medication. But other pharmacies have started to make it, and that is as completely illegal.
Yeah, and let's get into that in just a moment because I think that's really important for everybody to understand which places are offering this generic semaglutide legally and legitimately and carefully, and is a whole other thing to talk about who are all the people jumping into it just buying illegal stuff off the internet. And but let's get to that in a minute. I just want to cover like what it's like to actually have it in your clinic. So do they have to come in person every week for as long as they're on it?
They do.
Okay. So you're administering it. You're not sending people home with a self injection or anything.
Yes.
And what kind of results are you seeing with that?
Every person is different, but we have had 2 patients who have lost over 110 pounds. I've
Wow.
had many patients who have lost somewhere between 40 and 60 pounds, and I can't tell you how many patients have lost between 20 and 30. It's
Uh-huh.
very successful, but patients have to be patient. So there are some people who will lose weight on a very low dosage, and there are some people where they have more insulin resistance, and we have to get them up to a higher dosage. But we move very slowly because we don't want them to have a gut that does not move.
Yeah, very important. And for people at home, when your gut slowed down, okay, a little bit, and you might just feel a little bit of discomfort and that might pass. But when your gut's really slowed down, it is extraordinarily uncomfortable, if not like painful. And that can happen with this drug, especially, right? If you ramp up too quickly.
Yeah.
So I had an ER doc on the podcast a week or two ago, and she was saying that they see a lot of these patients who are on semaglutide, however they're getting it, and they're coming into the ER with nausea and vomiting, and they freak out because they weren't told that was possible, and it's really because they ramped up way too quickly and they weren't really monitored. She
Yeah.
said it's really common. She sees them all the time.
I would say that in my clinic, I see many patients who have purchased semaglutide in some way off of the internet, or they go to a clinic where they send them home with starting at a high dose, and then they go home and they have nausea and vomiting and constipation. They're very uncomfortable.
And then how long do people stay on it? Are they staying on it forever? Obviously, we haven't had these drugs for that many years.
Yeah,
And then how do you get them off of it? Do they ever come off of it? Can they maintain their weight loss after?
so we have patients who have been on it for over a year, and this drug has been around for many years at this point. We have long-term data on its safety, and it's very safe. Patients come off of it when they reach their goal. And what we have found is if they stop completely, they will regain their weight. Generally speaking, we have people come in once every 3 weeks for a maintenance dose, and they will maintain their weight in exactly the same place.
Okay, so once every 3 weeks. And does that maintenance dose go down a little, or does it stay where they were during their course?
It usually stays where they were, but if the patient was to develop more side effects because they're not being exposed to the drug as frequently, then of course we would lower the dosage.
Okay. And then what about the kind of lack of desire for food? If you're a foodie, is that going to ruin your fun?
I'm a fruity. I love my food. What happens is you eat less of it. So you
So you still enjoy it.
you still enjoy it, but you just
Okay.
eat less of it. You have an aversion to fat. So you're not going to be picking foie gras off the menu.
Okay. That's
'Cause
interesting.
foie gras and fat will generally make you feel like you had
Really
Thanksgiving
gross.
dinner. Yeah.
Okay. Interesting. So even one bite, you'll be like, no.
You won't want it. There's a food person.
Okay.
If you're going to go on vacation, just stop the shot 2 weeks in advance.
Okay. And then what about for people who are super into wine? Is it going to change their taste for fancy wine?
It changes your desire for wine.
Interesting. Okay, so maybe if you taste wine for a living, there can't be too many people like that. That might be a problem. Yeah, but if you're buying $2 Chuck, probably okay for you to be on this. I might get in trouble with Trader Joe's.
Yeah, when you come home from work and you're stressed and you're reaching for the wine because you're stressed and you want to
Mhm.
hit your dopamine, those are the people who stop drinking wine when they get home. If you're not someone who's using it as an antidepressant, it's not a good antidepressant.
No, it's a depressant to
It's
get that straight. Yes.
exactly. Then what? You can go out and you can enjoy a nice Brunello di Montalcino, and that'll be fine.
Okay, that's really interesting. Obviously, I have some personal interest in these things. Not that I'm that big a wine person, but I think during COVID, a lot of us became very much more frequent wine drinkers than we used to be before COVID. So good to know. Like it won't ruin everything, but it'll probably cut it way, way down, which I think would be really benefit all of us, honestly.
Yeah,
Ah,
I
go
would
ahead.
also say that most of my patients come back and tell me that they're very happy. They just feel happier.
So it's increasing your dopamine in general, which makes you happy. Does it help people with ADD? Because they're dopamine deficient. They're like searching for dopamine.
That's a really good question. I haven't treated anyone with ADD with this medication, so I don't
Okay.
know, but I could look it up.
Yeah, it'd be really interesting, right? Because that's one of the main things that is the issue in ADD is they're like constantly seeking dope, both with activities and with stimulation of various kinds. That would be a really interesting thing to look at as just a side effect. Oh, my ADD got better. That'd be cool. So, as far as side effects, we've talked about nausea, vomiting, we've talked about constipation, right? Can you
Yeah.
also get diarrhea with this, or is that less common because it's slowing
It's
you down, not
less
that?
common, but you certainly can get diarrhea with it. We have seen that, and with when people get constipated, since we're not increasing their doses a large amount on a weekly basis, they just take milk of magnesia, and that works every time.
It's okay.
So everyone's tried everything: Dulcolax, Senokot, magnesium pills. Nothing works. Milk of magnesia works perfect.
And what about the issue with thyroid nodules and thyroid cancer? Can you address that? Because in my research for our conversation, I found one source that thyroid cancer is not increased with that, but that's contrary to what I've read before.
So you really want to make sure that someone doesn't have MEN, multiple endocrine neoplasia. So if they have a thyroid nodule and it hasn't been worked up, it should be worked up. It should be biopsied.
Okay.
I have had several patients who I've had to turn away because they had thyroid nodules, and then they went and they had an ultrasound, and if it was solid, they had it biopsied. It was negative, and it was fine.
Okay.
But even that little physical that I do, I have caught a large bruit in a young patient and AFib with a heart rate of 38 in another patient.
And those things are incidental, really important findings in otherwise healthy people that if you treat them, patients do fine. So another plug for seeing your doctor for an exam every once in a while is really important. And also the other thing to point out is that thyroid nodules, so thyroid is a gland in your neck that makes thyroid hormone, and that kind of sets your metabolism, to simplify it. And it's super common to have thyroid nodules. Those are a dime a dozen. Back when I was in radiology, we used to see like almost every thyroid has at least 1 or 2 or 10 nodules. And so if you do, that's an important thing to biopsy, make sure it's not cancer. Most thyroid nodules are benign, but again, you don't want to stimulate something if it's there with taking this drug so you can lose weight unknowingly. So that's why one of the many reasons it's really important to have a doctor examine you first before getting. And the other complication that concerned me, and I also did a little research on this before we got on the line here, is about gastroparesis. So gastroparesis is something that we see in diabetics where their stomach basically becomes paralyzed and doesn't move. And so the consequence of that is that you eat and it just sits in this empty, unmoving sac and doesn't go anywhere. It's super, super uncomfortable. And the awful part of that for diabetics is that is permanent. It doesn't get better. Once it happens, it's permanent. So when I was trying to figure out, is the rate of that higher in people on Ozempic? It said yes, except for the rate in diabetics is a lot higher than the rate of people on Ozempic. So can you tease that
Yeah,
apart?
there's
Explain that.
no doubt that it causes gastroparesis. So normal stomach emptying time is 6 hours for solids. And when you take Ozempic or Mounjaro, your gastric emptying time is 12 hours. So you're stretching your stomach. The stretch receptors are telling your brain that you are full. You are physically full. So when you go to eat, you're like, ooh, I can't eat that much. I'm full. But it does empty, as opposed to someone who had diabetic gastroparesis where it doesn't empty well at all.
And does it ever become permanent the way diabetics get a permanent paresis, or
No.
no? So
So
that's not really a thing.
As soon as you come
Okay.
off the medication, the gastroparesis goes away.
Okay, so that's really helpful. So for people who are not diabetic, who are using this for weight loss only, they should not have any higher risk of permanent gastroparesis from doing this. Okay, unless they become diabetic.
But the goal is to help people to lose weight so that they don't become diabetic.
The idea is we see, so there's two different kinds of diabetes. So for people at home who don't necessarily know, there's type 1 diabetes, which is generally thought of as the childhood kind, where the cells in your pancreas that make insulin get destroyed and you just don't make insulin anymore. And those people have to take insulin to live, right? And then there's type 2 diabetes, which is what happens when you get basically too fat and you become over time more insulin resistant and then have frank diabetes. And that's a continuum from just having too much fat for a long period of time. In actuality, if you do use these drugs and become more fit and more svelte, lose your fat, then you have a much lower chance of becoming diabetic over your lifetime.
Yeah.
Am I summarizing that well? Okay.
Yeah, and if your blood sugar level is lower, then your insulin production will not need to be so high, and your insulin resistance decreases.
Yeah. So people who are pre-diabetic, this is a really great option, right? It
Absolutely.
potentially can reverse you and get you out of that state. So let's talk a little bit about what the heck is going wrong with this. Basically, the two drugs that we're talking about, so Ozempic is made by Novo Nordisk, and that's a diabetes drug, okay? And then they make the exact same drug, and they call it Wegovy, and that is the weight loss drug, but it's the same drug. So we keep saying Ozempic, but basically they're the exact same drug. So the generic version of that is a semaglutide base, and that's what was FDA approved. Now, meanwhile, Eli Lilly invented tirzepatide, which is Mounjaro, and that's the diabetes drug. And then they make the identical drug for weight loss, and that's called Zepbound. Okay, so a lot of different terms for the exact same thing, really, right? Doing the exact same thing. It's an agonist of this particular receptor inside your body. Okay, so what happened was when these came out, their popularity just skyrocketed. So instead of just the few diabetes patients, or not few, however many millions diabetes patients that they thought would be the audience for this, it turns out everybody and their dog wants to try this because everybody wants to lose weight, or almost everybody does. And so the demand has far outstripped the supply that either of these companies can supply either of these drugs. And so the FDA issued an emergency clearance, basically, and permission for compounding pharmacies to offer the FDA approved generics, so the semaglutide base and the tirzepatide, on an emergency basis, because those two companies can't keep up with demand.
So those companies that the FDA asked the 503B sterile manufacturing facilities to produce semaglutide and a little bit later on tirzepatide. These are very large companies that make somewhere around 50,000 bottles a day. It is closely monitored by the FDA and the Department of Justice. And then every bottle has to sit for a month. It undergoes HPLC testing to make sure it is exactly what it's supposed to be, and also sterility testing to make sure it's sterile and you're not going to give anyone an infection. Those are the only companies that have permission to do this.
And that's interesting. So what's happened is compounding pharmacies all over the country, and actually elsewhere in the world, are busy making semaglutide-like drugs. A lot of them are the salt and not the base. And that is not FDA approved at all. And those compounding pharmacies aren't really certified by the FDA to make this drug. Is that accurate?
Not certified by the Department of Justice either, who is the governmental body that oversees the compounding pharmacy. And they don't have the quality control.
And quality control is generally a problem with compounded drugs of all kinds. That a drug that is FDA approved, like that you would get, let's say Motrin from the pharmacy, it's very carefully manufactured. Anything that's compounded actually has a higher risk of infection, just baseline, even if you're doing it properly. So what we're having is all these places that are making the not FDA approved version of this drug that has not been proven to work and not been proven to be safe. We don't really know it's unsafe. Those versions, those just have never been analyzed, never been studied. And so all these places are making this and they're selling it on the internet. And I don't know about you guys at home, but for me, just on Facebook, on my personal page, I get ads directed at me to buy semaglutide and tirzepatide all the time. I don't know if it's because I'm in this business or what, but I get direct to consumer ads to buy this stuff. And you and I are both in a Facebook group where someone had published this link where you can just buy it and have it sent to your home. And it's like for laboratory use only, you have to click a little box that says, I swear to God, I'm not going to inject this in a human. This is for laboratory studies. And they'll ship it directly to your house. And so what in your mind are the problems with all of that?
Oh, there's many. They're sending semaglutide acetate, semaglutide sodium, some semaglutide attached to something. Where did they source their semaglutide from? They're not allowed to do this legally. So what country in this planet are they getting it from? What is it actually? No high pressure liquid chromatography has been done on it. We don't know what it is. It could be anything. Is it sterile?
I think that's a really big one as well. So one, is it really what it's supposed to be? Two, is it contaminated with something? So I've interviewed people on this show and just separately for the book where they got rip-roaring infections from tainted products that were purchased over the internet. And I just recently heard about a case, I won't say where, but it was in the ER where the person had self-injected what they thought was semaglutide. They ended up almost dying. And in the ER, they found that the vial had insulin in it, not semaglutide.
Yeah, and it could have fentanyl in it. You have no idea what
Right.
is in it.
And so I think people really need to understand that if you're ordering something off the internet and injecting it inside your body, that's extraordinarily risky because that means that you could get either an infection or another disease or just die. It just depends on where you're injecting it and what's being injected. But I don't think that people realize how dangerous that can be.
Yeah. What are the long-term side effects? What is the safety of semaglutide acetate? Let's say it is what it says it is. How does semaglutide acetate affect you or semaglutide sodium 20 years from now? We have 20 years worth of data on semaglutide and very safe. It's very effective. We have no data, as you've said before, on semaglutide acetate or semaglutide sodium, and that changes the nature of the medication that you're injecting completely.
I didn't realize they had been studied for that long, 20 years.
Long time.
Do you know when it was FDA approved? I feel like it was more recent.
Look it up on the internet.
Okay, we haven't looked that up.
We've been using Januvia and Byetta and Victoza, which are all semaglutide, for at least 10 years. At least.
I don't know those, actually.
Byetta is a daily injection of semaglutide.
Ah, okay.
Januvia is a pill. Victoza is a weight loss drug.
And is there an advantage of the injectable form over the pill? Obviously, a pill is easier.
Much better blood sugar control.
Okay. So it's way more effective if you inject it. There was a case, this was just published a few weeks ago, that a bunch of actual fake Ozempic pens. So Ozempic comes in a form where you can self-inject it. It's like a preloaded pen, like an EpiPen, and massive stores of fake Ozempic pens were found in a warehouse in New York, and that the FDA is investigating that. But those were fake and came from China. I don't know what was in them, but literally they were trying to spoof it the way they try to spoof Botox, which we've seen now. You and I did an episode about the things that could go wrong with Botox. And only a month or two later, there were 22 cases of botulism from fake Botox that was made in China. And you have to remember, if the Chinese are making a fake handbag, you probably won't die from that. But if they're making fake Botox or fake Ozempic, there's a decent chance you could die. So just don't buy it. Don't use it.
Think about the baby formula from many years ago.
Yeah.
and there was lead in the baby formula.
And I think melamine too. And there was melamine in the dog food. And I think we talked about this in a
Yeah.
previous episode. Yeah. If you're going to ingest it or inject it, I would not get the fake stuff. Okay. This is why this is so important. One of the things that's happening, because there's so much money in it. So I don't know if you want to talk about pricing, but recently an acquaintance was prescribed Ozempic, but was told it wouldn't be covered by his insurance. And he was quoted $1,600 a month for real Ozempic if he was going to pay out of pocket.
Yeah.
And then there's places like yours that are legitimate and doctor run and getting the proper stuff from the approved compounding pharmacies. And those prices range, I'm guessing, anywhere from $300 to $600 a month. I don't actually know, but in there.
So we charge by the dosage.
Yeah.
So someone who's on a low dose semaglutide up to 1 milligram, we charge $450 a month. And that includes the office visit with the physician, the history and physical, the initial shot, and then a weekly visit with my RN. And if there's any issues that she has, she comes and she talks to me, and there's always a doctor in the office.
Okay.
If you go up between 1 milligram and 2 milligrams, it's $550 a month. And if you're going to go higher than that, it becomes $650 a month. The highest dosage is 2.4 milligrams.
Okay. So basically, it's still what a lot of people would consider pricey, but nowhere near what it would be out of pocket to actually pay for Ozempic, right?
Yeah. Very few people make it to that higher dosage.
Yeah.
It's usually $450 or $550.
Okay. And so basically what's happening, because there is that money in it, there are all these people who are not doctors, not trained, ordering the fake stuff off the internet and offering that as though it were the same thing that doctors like you are providing. And so now you have this kind of, it's not people ordering it at home and taking their own risk, but they're thinking they're going to a legitimate place, getting what essentially you're providing in your practice. They think they're getting that, but in fact, they're actually getting illegally produced product over the internet provided by someone who can't practice medicine on their own. We've seen cases of non-medical people or RNs who can't practice on their own doing this because they can, and people will pay for it. And I have to say, the demand is so enormous. This is a massively high demand for this drug. Just so people understand, like, the FDA does not issue this emergency clearance because of demand. Hardly ever. It's really rare. Usually it's in the case of like a pandemic or something, which of course we don't. We just survived a pandemic, but typically this is something we just never see in medicine, right? This is extraordinary times. And one of the risks, I think, of anyone like yourself, or I've considered it, we have not started to offer this in my practice at all, but the risk is Novo Nordisk and Eli Lilly could speed up their production, somehow meet the demand, and magically, all of a sudden, the FDA withdraws this permission. And at that point, you won't be able to do this anymore. I do think that that is extremely unlikely to happen because we're talking about this just many orders of magnitude higher demand than there is supply of the real stuff. So I don't think that's likely, but it's not impossible.
Yep, it happens, and we won't be able to offer it anymore.
Yeah. A lot of these places are just cashing in on, I'm going to make as much money as I can right now, and nobody's watching. And I do think that one of the things that I've been trying to stress on the podcast is just ask the right questions. What is your credential? Am I going to see the doctor, or at least an NP or a PA who works under the doctor who can do the assessment? And then this has to be prescribed by a doctor. This is a prescription like any other medicine. And I do think that people understand that when something's injected into you, it's a prescription, but maybe not everybody understand that. I don't know, but
they understand that.
Yeah, but it's really important to ask those questions to make sure that you're not endangering your own health, because we have seen now Ozempic tainted with various things. But the insulin to me was the most scary, because if you inject too much insulin, what insulin does is it takes the sugar out of your blood and you can just die because your brain doesn't get enough glucose. And so it's just amazing when you have a little vial. It comes as a liquid, correct? Or do you have
All
to
right, it can
reconstitute it?
either come as a lyophilized powder that you reconstitute, or it comes in a liquid.
And you just have to trust that what's in the vial is what you think it is. And so you, gosh darn, better be sure that you're getting the real stuff.
I trust that it is what it's supposed to be because I get it from a 503B compounding pharmacy.
Yeah.
But I don't know how people receive it from the internet. It's something I would never encourage. It may be reconstituted in liquid, or it may not. I don't know.
I think it's just important that if you are going to a new place and you're really interested in getting semaglutide or tirzepatide or terzepeptide, I don't know how people are pronouncing that one, to ask where they're getting it from and who's prescribing it. Make sure you get a real assessment in the beginning and make sure you follow up with them, because the GI issues, so nausea, vomiting, discomfort, all that stuff, is really common. So it is likely that you're going to have a little bit of that, especially in the beginning. And you want to make sure that somebody can monitor you and make sure you're not getting really sick. And it'll also keep you out of the ER too. So really important. Don't do this at home. See someone who's qualified to do it and make sure you have that kind of follow up with a qualified provider.
Yeah. The only other thing I would add is ask them what pharmacy they get it from.
Mm-hmm.
And then look that pharmacy up on the internet. If you put in 503B compounding pharmacies, then you will get a list of all the 503B compounding pharmacies in the country, and there aren't that many of them. If the pharmacy is a 503A compounding pharmacy, they're manufacturing it illegally.
Okay. And that's really helpful. It needs to be a 503B compounding pharmacy.
Correct.
Not 503A. So that's an important lesson, especially for me, because I didn't know that. All right. Is there anything else you'd like to leave our listeners with?
No, I think that was a really good discussion. I hope it helps a lot of people. And it's always great to talk to you and great to do these podcasts and get the word out to the public.
Yeah, I really appreciate your coming on and talking about this stuff. I think it's really important and timely. And I'd love to have you come back and we can talk about another fun topic.
Well, I'd love to come back again.
All right, cool.
Have a great day.
Thanks, Judy. If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's drkatedee.com. Or reach us through the website medspamayhem.com. And read the book. Medspa Mayhem is available everywhere books are sold. Thanks for listening. This has been Medspa Mayhem with Dr. Kate Dee. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. Medspa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.